This is BBC News. Brazilian butt lifts should be banned according to a new...
British woman has died from so-called Brazilian butt lift surgery.
In 2018 and 2019, we saw multiple deaths. We saw a lot of societies around the world, the plastic surgery aesthetic societies around the world, come up with directives to plastic surgeons that BBL should no longer be done. However, right now in 2026 as a plastic surgeon, I do still do BBLs. So is it the same? Am I doing something unsafe? In this video, we'll be talking about how BBL has progressed from what it was in 2018-2019 to what we do right now in 2026 and how it is a very safe procedure. Hi, I'm Dr. Saumil Shah. I'm a plastic surgeon, director of plastic surgery at Skin Zone Aesthetics in Borivali West, Mumbai. Prior to 2018, the BBL, which was called the Brazilian butt lift, however, interestingly, not invented in Brazil. It was basically invented in Miami, in the US, and people would do a lot of fat grafting into the buttocks. Now, you have to understand when we say buttocks, it is not just one area. It has multiple layers to it. There is the skin, then there is the fat under the skin. This fat itself is divided into two superficial and deep layers. Then there is the muscle under this, and then of course the bone. Most of the BBL surgeries prior to 2018 were talking about putting fat into this muscle. And right below this muscle, there were large blood vessels. These blood vessels connected directly to the heart. And they were veins, so they had very low pressure in them. So what was happening before 2018 was a lot of these BBL surgeries were where the fat was being put into the muscles. When the fat was put into the muscles, right below the muscles, there were big veins that connected to the heart. If for some reason the veins got damaged and the fat went into these veins, they would go and cause blockages in the heart and the lung and cause deaths. And that's why BBL surgeries were banned in 2018 by multiple task force, including the International Society of Aesthetic Plastic Surgeons, coming out with a directive that it should no longer be done. So right now, when we talk about doing BBL, we are not actually talking about the procedure that was originally BBL. At the time, a lot of papers and a lot of research was done by doctors in cadavers, seeing as to what was the issue. There were a lot of papers that came out, and it was found that the issue was that the fat was being put inside the muscle, and even if the veins were not torn, it would still cause issues. So what was the solution? Well, we don't put fat into the muscles anymore. What we do is put fat right under the skin in the fat itself, which is above the layer of the muscles. However, you have to understand that buttocks, the fat in the buttocks, is not like a single homogeneous thing. One, it has two layers, a superficial and a deep layer, separated by a sort of what is called as a curtain over there, which is called as a fascia. Inside this as well, the fat is not in a single one layer. There are multiple tree branch like things that come from the muscle to the skin and separate this fat into separate globules. So if we just put in fat how we normally would, this fat would accumulate in certain areas. Also, if we put in fat in a way where it's pushed in like a single glob, it would sort of die off and cause other complications. So what was done was a technique called EVL, expansion vibration lipofilling, where we use something called as a power assisted liposuction device like micro air that we have, and we would sort of do other things as well, like using a bent cannula, using a larger cannula. We would do other things as well, like getting the patient into a certain position, using a larger cannula, using a bent cannula, and there were multiple other directives that came out which made this procedure safer. So this was EVL, expansion vibration lipofilling. Then in 2024, 2025, people started realizing that we have a device that can look inside, which is an ultrasound, probably a little earlier than that as well. So what we started doing was put in the fat and then under ultrasound guidance, see to it that it was in the right layer, it wasn't going deep into the muscle, and then spread this fat using ultrasound. And this has now sort of become a standard of care the world over as well. So yes, now we have progressed where the BBL has become safer and safer, and where usually deaths related to BBL would be a problem with technique sometimes, and not a problem of the wrong method being done, because more research went into it and a lot of doctors acted like scientists and found out why the deaths were happening. So BBL in 2026, where the fat is not put into the muscle, is one of the safest techniques out there.